We're living longer lives, but with more years in poor health than at any point in history. How can we change this? And what are the pharma industry's responsibilities and opportunities? These questions and many more will we, MSD, try to answer together with people of different perspectives. By creating a space for dialogue, we hope to promote diversity of opinions and provide food for thoughts. We call it Voices of Pharma.
Hello everybody and welcome to the latest episode of Voices of Pharma. My name's Julie Willingham and I'm joined today by Annika Szabo Portela, the Managing Director of EIT Health Scandinavia. Annika, welcome.
Thank you very much. It's a pleasure to be here and I really look forward to an interesting discussion.
So we're going to talk a little bit more in a moment about the principles of high value care, but maybe to get us into the subject, you could just tell us what the areas of focus for EIT Scandinavia are.
Yes, so we work cross borders in Europe, and the mission is to improve healthcare systems, but also with the healthcare economic perspective in that. So one could say that we try together with our partners and stakeholders to speed up implementation of innovation in healthcare. And the purpose of that is that we all should live longer, healthier lives.
So Annika, when we talk about high value care, let's kind of ground everybody in a basic understanding of what we mean by that. Maybe you could just tell us in terms of EIT in your own perspective, what does that mean?
Yes, so for me, high value care refers to the restructuring of healthcare delivery towards measurable outcomes. We have talked about that have high impact and matter most to patients, but also to the healthcare providers now. And this is also then a way to make sure that healthcare sector pay for the outcomes rather than the service volume delivered. And what do I mean with this? If we look at healthcare today, a hospital or a clinic more or less get paid from the number of patients that come to the clinic, to the hospital, the number of treatments. High value care would like this shift to be that why not instead have financial incentives if the patients do not come, because we actually invest in prevention. We make sure they don't need to use a hospital stay, or if they need care, maybe it's better for them to get that care in home setting, and it's also cheaper. So it's about the patients, but it's also about the healthcare providers, and it's shifting the payment model.
So Annika, you mentioned incentives in the definition of high value care, and that makes me think of payment for results. How do you see that we can move towards that?
Well, we need to get started because today I don't think that we are good at measuring end results and how things are going for the individual, the patient and society for real. And just as an example, today, if you have an Alzheimer patient and he gets prescribed an digital aid, for example, you tick the box, you get paid for that in the system, but regardless if this technical aid actually helped the patients in daily life. So it's really about the shift. It's not just the care that is given without taking into perspective or listening to if it really helped, or if the patient actually had requested something else. So it's an extraordinarily important question, because it's really a shift in how we look upon financing healthcare, and the outcome that matters most to patients is really central. But today, that's not how you finance healthcare.
So obviously, in terms of why high value care is important, it's all about the patient and the payer, but maybe you can tell us a bit about the High Value Care Forum and how that links to that ambition.
Yeah, because you asked me also what is EIT Health and what we focus on, and obviously if you want to change healthcare, work towards that's very broad. So we are currently having focus areas. We happen to call them flagships, and high value care is one, but we are also focusing a lot now, topical in Europe, with the European health data space. So health data is also of great importance. So this is always with the patient in focus. So high value care for us is to strive towards the kind of outcomes that really matters to patients the most.
I think for a company like MSD, where we're obviously very interested in data sharing, but the outcomes that you need to look at from, on one hand, a population-based intervention, to the other, something for a very specific orphan drug space, is quite different. So what do you think those technical infrastructure needs would be, given that enormous diversity, that enormous range of needs?
I would ask the question back to you, because here I think that pharma sits on a lot of knowledge and expertise, and your advantage is the vast amount of data, but also data on big populations, but stratified. Because if we look into healthcare, it's not always we get that kind of clean data. It's mixed. So here I would very much welcome a dialogue from healthcare. How can we do this, and what can we learn from pharma that is actually already doing this? And then we have the ecosystem then of startups in between that today might have difficulties getting access to from data from hospitals as well as from pharma. But could we use then a common standard and a common infrastructure platforms for that? I think we would really start also to be competitive in Europe. So this is the fundamentals also with this initiative of the European health data space, to have interoperability, to have data that actually is both accessible but then usable for different types of uses.
And that's obviously really important as we sit here in the Scandinavian, or Nordic as we call it, from an MSD perspective, because we have such rich data sets available. And so I think that having this infrastructure to allow us to share that data is something we're very interested in collaborating over. We've talked a lot about all the benefits of pushing the ecosystem towards high value care, but do you see any potential pitfalls, or do you have any concerns of areas that we need to look out for?
Yes, there are barriers and pitfalls that we are then working on, and we have mentioned a few of them, but really important ones. So it's health data fragmentation, it's multiple conditions for data use, it's also limited access for users to get hold of good quality data. And foremost, I would also come back to the lack of legal and regulatory framework for secondary use of data. This is what the European Health Data Space Initiative is working on. But even with new framework, new regulation, it's a huge effort to make all these systems actually interconnect. And it's also a question of important investments. So who is going to pay for all this to happen? But I think a driver is that if we don't do this, we would lag after in Europe. And I would also see this as a harmonization cross borders to be able to use health data as very much needed, because the backside, if we don't do it, and we see it already today, we have SME startups, but also bigger companies rather looking towards other markets. They go to the US or they go to Asia, because it's so complicated and fragmentized in Europe. So it's more attractive to go elsewhere. So it's an investment that we need to keep our assets here. We are on the way, and it's a collaborative effort that we will have to do. It's something that the European Commission is, leading the way. But I think in the end that we all like this to happen also, to feel that it's a competitive but also a market of interest for us, health-wise also. I would like to get my care here. We are a little bit in the beginning of it, and huge investments and efforts are still to come. If you allow me, I think one reflection here is also that we know that implementing change in healthcare is slow compared to other sectors. Naturally, we know also why that is, but here I think we could learn from other sectors. And for example, the finance or the bank sector went through something similar just a few years ago, and today we have all sort of payment systems that speak to each other, and you can transfer money and take loans on the phone wherever you are. So I think we could look into that kind of technological solutions that others have been using, but also what spurred, the speed in the implementation. So here I think it's also the beauty of innovation, that you have a look what others are doing and maybe get on working with those that you usually don't do.
Very wise. So Annika, thank you very much for joining us. It's been a pleasure. Thank you for joining us, and join us again for the next episode of Voices of Pharma soon.